I'm an assistant professor in the Department of Emergency Medicine, and I staff the adult ER here at University of Michigan Health System, and I'm also a health services researcher. My interest in health services research initially started as an interest in disaster medicine. I grew up in Iran, and when I was in middle school, it was the time when the Iran-Iraq war was going on, and there was a lot of bombings of Tehran and a lot of casualties, and I have very vivid memories of those experiences, and that made me very interested in becoming an emergency physician, one, and secondarily spurred my interest in disaster medicine. I trained in emergency medicine at Jefferson in Philadelphia, and following my residency, I did a fellowship in health and health services research at the Robert Wood Johnson Clinical Scholars Program here at the University of Michigan. From there, I became interested in larger health system issues beyond disasters and hospital response to disasters, and also became interested in daily challenges of healthcare delivery. I would hope that my research would inform improved design of healthcare systems in a way that patients can receive acute care in a more expedited and efficient manner and improve patient outcomes. For example, coming up with informing interventions that would be implemented in emergency departments and inpatient units in hospitals across the country that would mediate some of the adverse effects of overcrowding in the hospital and inpatient setting. Healthcare costs in the United States are one of the biggest challenges to our healthcare system today. One of the ways of addressing it is a better approach to managing unscheduled acute care in the United States. And by doing that, we can probably save healthcare costs in our country. What IHPI does that is probably unique to the Institute is facilitating multidisciplinary collaboration in almost any realm that you look at, in science, humanities, really almost clearly medicine. We have expertise in all these realms, and IHPI is a vehicle by which all these different disciplines can come together to do policy-relevant research and answer complex questions. I'm a big believer in multidisciplinary research, and one of the things that a couple of colleagues and I here at IHPI are beginning to do is to work on instituting a center within IHPI called the Michigan Center for Health Services Research and Acute Care. And that will facilitate multidisciplinary research efforts in the realm of acute care research and answering very complex issues related to the delivery of acute care in our country. I hope that our healthcare system in the future will be more informed by the evidence regarding which therapeutic and diagnostic modalities are most cost-effective in caring for patients, and that the evidence guide how we treat our patients, and also including a more patient-centered approach in managing our patients. IHPI, by facilitating multidisciplinary research and answering complex questions related to our healthcare system, can pave the path to improved healthcare delivery in the United States.